Victoria's coronavirus alert has spread overnight, with Sunday's AFL match at the MCG revealed as a major exposure site. Health authorities have confirmed a positive COVID-19 case attended the Collingwood-Port Adelaide game. People sitting nearby are being contacted directly, while others with symptoms are being urged to get tested and isolate. The list of exposure sites has spread to Melbourne's inner city now, as well as Bendigo in regional Victoria. At the moment, the cluster has 9 cases spread across 3 households.
Masks are once again mandatory indoors across Greater Melbourne, with tighter restrictions now in place. There were some long lines at COVID testing sites yesterday and a spike in demand at mass vaccination hubs. We've got full coverage for you this morning, so let's begin with Zali Rismal in Melbourne. Good morning to you, Zali. There is definitely some concern, given one of the 9 cases we're now learning visited a football game while infectious.
That's right. Good morning, Lisa. So there are fears that some football fans who attended an AFL match here at the MCG on Sunday may have been exposed to COVID-19. The Health Department late last night issued an alert that a positive case attended the Collingwood and Port Adelaide game on Sunday afternoon here in Melbourne. Now, authorities are contacting spectators who were sitting in the area where that person was. He was sitting in Zone 4, Level 1 of the Great Southern Stand. Now, anyone who is in that area where he's been sitting will need to isolate until they receive a negative test. But there's also a general advice message that anyone who attended the game who is experiencing symptoms must go get tested and isolate until they receive that a negative result. So it is concerning. There were more than 23,000 spectators at that game on Sunday, but we've also seen that list of exposure sites increase overnight. There are now dozens of exposure sites listed, including 21 high-risk Tier 1 sites. We've also seen those sites creep out into regional Victoria. 2 sites identified in and around Bendigo on the weekend. Now, a positive case attended a hair salon in Bendigo and also attended a function at the Axdale Tavern on Sunday as well. Now, we've also seen sites added in and around Melbourne, several sites including cafes and restaurants in Port Melbourne, and also a bar in Fitzroy North where a case attended a party on Sunday. So we are expecting that list to grow. We've seen overnight reports that RMIT has sent out an email saying that their campus has been identified as an exposure site. That's not on the website yet, but the best thing that people can do is to keep up to date with the Health Department's website and just to check if they have been to any of these sites.
And the recommendations for what you should do, if you have been, is on that website. Zali, thank you for the details. We'll stay across all of this, and we are going to now speak to the CEO of Whittlesea Council in Melbourne's north, because they're setting up mass testing centres in response to the growing cluster. Craig Lloyd joins me now. Good morning to you. How are you feeling about the situation at this stage?
Yeah, good morning, Lisa. Look, obviously it's still an evolving situation. It's quite a stark reminder for all of our community that the virus is still out there. People really need to take this seriously. And if they have any symptoms or they've been to any of those locations that have been listed on the DHHS website, that they really need to get tested. And I think also it's a reminder that if you're eligible for a vaccine, the best way through this situation for all of us is to go and get a vaccine.
Having said that, there are reports this morning that those who have contracted the virus who are over 50 had not been vaccinated at all. Have you been able to confirm those reports?
I haven't. That's something you'll need to raise with the Department of Health. But certainly if you're over 50 or you're in one of the eligible categories for the vaccine, there are plenty of places available now to get those vaccines, including a new pop-up mass vaccination centre in the building right next door to us here at the council offices in South Morang.
What else is the council doing today to try and get across this situation, Craig?
We've been working with the Department of Health to quickly establish some other test centres, and they were obviously very busy yesterday. They're open again today. We're really focusing on helping the department with getting messaging out to our community. It's a very diverse, multicultural community. We have about 30% of our residents here that English is not their first language. So we're working closely with the Department of Health to get those messages out there, make sure people understand where the exposure sites are, and what they need to do, and also how to access the vaccine as well.
Why do you think people are still reluctant to go and get tested when they've got symptoms? You'd have to be concerned about that being one of the reports we're seeing today.
Yeah, look, I think honestly a bit of complacency slipped into our community generally, right across Victoria and maybe broader than that. We're coming into winter, coughs and colds become quite normal in winter period, and I think people have put it down to that, assuming that it's not COVID because we haven't had cases. And obviously in this situation, people may have done that, and before we know it, there are cases popping up. So again, slightest symptom that you have, even if it's just a tickle or a bit of a runny nose, please go and get tested.
All right, and just before we wrap up, what's the biggest challenge for you today as the CEO of the council? How are you hoping the day is going to pan out?
Look, like everybody, I'm hoping that the tracers have managed to trace all of these cases and that we don't see too many more cases popping up, or particularly cases that can't be linked back to the original case. I think that's probably the biggest fear. But our focus at the moment, as I said, is getting the word out, making sure that everyone, no matter what language they speak, where they live, if they live in the city of Whittlesea, that they do go and get themselves tested if they've been to a site or they have any symptoms.
Craig Lloyd from Whittlesea Council, thanks very much for joining us this morning.
No worries, thank you very much.
Let's go straight back to our top story now, that growing cluster of COVID infections in Melbourne. We're joined now by the Chair of Epidemiology at Deakin University, Professor Catherine Bennett. Catherine, good morning.
Morning, Michael.
So we have 9 cases. The good news is they're all linked. I guess one element of the bits of bad news we got last night, the MCG and all 20,000 people there on Sunday, an exposure site. So as we wait the latest figures, if there are any, how are you reading the situation?
Look, that's right. You don't want these big venues to be included in these exposure sites. What we do know, though, is the MCG operates with a strict zoning system, so that does start to bring back the number of people that are in the more kind of close watch and potential contact group. So those in Zone 4, I think it is. Yep. And they can look at the different levels as well, and they're monitoring CCTV to understand that person's movement, just to really fully assess who else they might need to contact. So I do think that's a reasonably low risk. It's an outdoor venue, so that certainly helps. We are seeing an increase in the exposure sites overall overnight, though. We're now up to 40. But as you say, these are close contacts of 2 key cases. One who now looks like they're pushing back a bit closer to, we know, the source case. Maybe there's another missing link, maybe not. We expect our close contacts to be at greatest risk of infection, and that's what we're seeing. And we've so far had results back on over 80 close contacts. So about 10% positive is actually what you'd expect for these very close, particularly household contacts.
Which is great news. And I guess the great fear is that if there are mystery links, mystery cases out there and the possible chains of transmission involving them.
That's right. The older gentleman, case 5 that we heard about yesterday, does take his onset and exposure dates back that little bit further. It is feasible that he might have been infected directly somehow if he did cross paths with the Wallet man who was the source case for this cluster. But there could be another case in between. The good news there, though, is we've had great response in testing. And so that's the most important thing. Anyone with symptoms, if they're getting tested, helps rule out any other offshoots of this chain of transmission. That would be a real concern if we started to see cases, again, that we couldn't directly link up. Then we'd know we had wider spread community transmission, but we're not seeing that yet. But equally, we're focused on those contacts. They're the ones we're testing. We still need everyone else around those people and around those exposure sites to come and get tested, just to rule out that there's any more sort of undetected spread. Indeed.
It turns out one of the infected people was symptomatic, as in having symptoms, be it a cough or a sore throat, and moving around in the Melbourne community for up to 10 days. I guess that's a stark reminder, if any was needed, that if you have symptoms, Catherine, there's really only one thing you need to do, and do so urgently.
Absolutely, Michael. And I think it's one of the risks coming into winter. It's not only about moving indoors and increasing your indoor mixing, it's actually having the cold and flu signs and symptoms that people expect anyway. And so they're not on alert, particularly after we've had this extended 3-month period without cases. People just start to think, I've got a cold. So the message is well taken here. You know, we have to test for any symptoms that could be COVID, just to rule that out, particularly if you've been anywhere near those exposure sites.
And just before you go, I guess another wake-up call as well for those possibly who are eligible for vaccinations putting off their dose.
That's right. You know, it takes a while to build up immunity, but you start to get some immunity after your first dose within those first couple of weeks. So if you get vaccinated now, if there is virus in the community, that then protects you going ahead. We have heard that the people over 50 who were eligible for vaccination here haven't been vaccinated, and it might have changed the outcome. We might have had half the people infected, even if some of these had only recently had their first dose. So vaccination is really important, and now's the time to think about trying to book that in if you're eligible.
Indeed. Catherine Bennett, as always, from Deakin University, appreciate your insights. Thanks for joining us this morning.
Thanks, Michael.